This is my student support system. Keep watching, keep learning.
Techniques of supervision means how we supervise. What are the steps and what are the techniques? In the supervision, we use 7 types of techniques. If we discuss them, or if we list them, these are observation, it is best technique. Apart from this, guidance and demonstration, checking records and reports maintained by the supervisee, conference and meeting, field visits and rounds, supportive supervision, and evaluation and feedback. So there are 7 techniques of supervision. Now we will discuss them one by one. First one is observation. In this technique, we just observe the supervisee while he is in action. Means he is or she is doing her or his work. We just observe. Directly observing the work of staff or students. This will help to identify the strength areas and the areas which needs improvement. It can be planned or unplanned. We can just observe with planning or without planning. So both way we can do our observations. Example of this type of supervision where we use observation technique is just observing or watching an ANM while she is conducting immunization in the immunization clinic, and during this we assess her communication skill and injection giving technique. So this is very good technique for supervision. Second one is guidance and demonstration. This is also very good technique. During this, we demonstrate correct procedure or skill, because here we are there to guide and to improve the skills of the supervisee by demonstrating the correct procedure or correct technique of doing the procedure. This can be done by giving individual or group guidance as per need. Here we encourage the supervisee learning by doing, means we do and client learns. And we can also use written demonstration technique while uh, the client or the supervisee gives written demonstration, and if he or she is doing well, then we can say yes, you have learned it. Example, demonstrating proper hand washing technique before the procedure or proper injection giving technique. This can be demonstrated. Next supervision technique is checking records and reports. Reviewing the registers maintained by the supervisee, reports he or she is sending, and any documents that are prepared by the supervisee. We can observe it and we can find out how efficiently she or he maintaining it. During this supervision, we can ensure accuracy and completeness of the records, and we also help to identify service gaps and errors while maintaining these records. So proper recording and reporting we can explain to the supervisor. Example, when we are supervising the ANMs, we can check the ANC register for completeness of the entries. And if there are any lacuna, we can explain. Next supervision technique is conference and meeting. Conducting individual and group conference to discuss the performance with the ANMs if we are supervising ANM or any other staff. During these meetings and conferences, we promote open communication and problem solving. If she is or he is finding any problems there, we can solve the problem. These conferences or meetings can be done daily, weekly, or monthly as per availability of resources. Example, staff meeting to review immunization coverage. Next technique is field visit or rounds. This is also very good technique. We can again supervise the supervisee while he or she is in action. Supervisor visit health facility of a client or supervisee or even community sites. Observe the activities and interactions with the client and offer on the spot support and feedback as per need. So this is also a good technique of supervision. Example, LHV visiting the sub centers or accompany ANM for supervision during home visits. Next technique of supervision is supportive supervision. This is the best supervisory technique. In this, we focus on mentoring, coaching, motivation, and learning. Emphasize the problem solving rather than fault finding. We supervise and we correct the uh, mistakes on the spot while supporting or supervising the client so that he or she can learn during the supervision process. Builds the staff confidence and teamwork during supervision. Here, our goal during supportive supervision is to continue improvement but not punishment. We are not there to find the faults or the errors. We are just to improve what the client or the supervisor is doing. And next or final technique is evaluation and feedback. We evaluate and provide feedback to the client so that he or she can improve. Comparing the performance with set standards, to what extent the client has achieved the goals, providing constructive feedback on the spot or after the activity, and then we also encourage self-assessment. During evaluation and feedback, the feedback should be specific depending upon the activity or the procedure done by the client and timely, and it should be supportive. For example, finding error in the report and just telling what is the correct technique of calculation and to give the data to the higher authorities. So this is all about techniques of supervision.
My student support system. Keep watching, keep learning.